All righty. So I'm going to go over to my next guest here. I think I have Kokio in the Rehab Power Hour. Can you hear me? I hope I'm pronouncing your name correctly, or do you have a preferred pronunciation?
Kokio is correct.
Okay, very good, Kokio. Well, first of all, welcome to the Rehab Power Hour. Thanks so much for being here with me. Would you mind giving me a little bit of background about who you are and where you're calling from?
I'm calling from Washington, D.C., and my sister and I are online right now because her mother suffered a stroke in 2019. Her recovery was interrupted due to COVID. She also had broken vertebrae from falling during the stroke. She was catheterized. So now she's back in progress to rebuilding her strength through other therapies. Now we're just trying to see if we can accelerate strengthening her left side, where her arm is, the muscle is contracted and her foot kind of turns inward. She's scheduled for Botox injections just as well to relax those muscles. So we wanted to know if we could augment her recovery by using robotics.
Sure. Yes. The easy answer is effectively yes. When it comes to the recommendations from the American Heart Association, sort of the stroke subset, they make these what are called clinical practice guidelines. It's basically a consolidation of all of the best practices when it comes to helping individuals with stroke recover. And their conclusions were that these so-called multimodal approaches are really, really helpful. And what I mean by multimodal is a combination of both pharmacologic and motor recovery. So something like Botox is very well suited to be integrated with a high intensity repetitive task practice program that's delivered by like the Motus hand. And they actually, generally speaking, you want to pair them really closely together because Botox, as you said, can really help overcome some of those limitations in someone's extensor muscles in the foot that force us into what's called plantar flexion and inversion. And also in the upper extremity can be very helpful to overcome that flexion pattern as well. But what happens is following Botox is you really want to layer on the motor recovery that will help you regain what are called endogenous controls, right? You want to gain internal control. And the reason that Botox is really good because it can kind of help reset the balance of our flexors that are normally dominating the phenomenon to allow our extensors to actually kick in and provide some force. So I think it can be very well suited following a Botox injection to do something like this to, as you say, supercharge the recovery. You know, it's really, really hard absent the ability to do rehab in the home to get the amount of hours and repetitions that are required to make changes in the brain, right? An hour a couple times a week in PT is good, but we know from the scientific evidence that it takes many, many hundreds of repetitions per day to actually induce those changes that are long lasting. And so I think something like this could be a good fit.
Okay, that sounds good.
Sure. And you mentioned that you had some of your family members as well on the line. I'm happy to answer any questions as well if you guys have questions related to neuro rehab in general or specifically about the systems here.
Yeah. Can you hear me?
I can, Debbie. Yes. And Debbie, are you? Oh, go ahead. Go ahead.
I was just wanting to ask the question that's sitting over there on the side in the chat room. And
yes, Debbie.
So we're sisters.
Yes, Debbie, that's good.
And my other sister is online, and so is my daughter. So it's kind of been a collaborative effort in trying to, in helping and supporting our mom, you know, and getting back all of her faculties and independence. So my thing was, she is sitting, and her core is strong now. As my sister stated, her foot that turns in that side that's weak with her right now in physical therapy, we're standing her up, and with the left side being weaker and it turning in some, will the apparatus, what's the name of it?
The Motus Foot, yeah.
Yeah, will that start to, in using that, will that strengthen those muscles, and will that help her to control her foot and the way that it's turned in and everything? Will that start to make that stronger on that left side?
Yeah, this is really, really important to mention. I think when it comes to the lower extremity, you guys probably know this, but it's just good to mention, the pattern is opposite than the upper extremity, right? The upper extremity, we get this sort of flexion posture where our fingers curl into this fist. But in the lower extremity, we get this plantar flex, which is basically like if you're driving a car and you press in the gas pedal to accelerate, that's plantar flexion. But you also get this sort of what's called a concomitant inversion, meaning your foot turns in. And that can be very challenging, right? Especially when you're trying to reestablish walking, because then what happens is your toes catch the ground, or when you start to progress, going over curbs or going upstairs, very, very troubling. And so specifically, the Motus Foot is designed to help people learn to dorsiflex and evert their foot again. And so it's a little bit strange because the muscles that do these sort of motions, they actually do the motions in what's called an off-sagittal plane. So the tibialis anterior and the peronei, the muscles that actually do this eversion, this motion that you're describing to help sort of prevent foot drop in that inverted position, they are worked with the Motus Foot. And so it not only helps improve the strength of those muscles, but it also helps improve the coordination. And so by nature of doing the exercises, you are also working on not only just improving the raw power those muscles can produce, but being able to appropriately coordinate them, which is exceptionally important when you start to restart walking, right? We have to be able to activate those muscles, not just on bulk for a given amount of time. We have to turn them on at the appropriate time. Like when you're walking, you need to be able to turn those on when you're in a hip flex position, when you're trying to step. So that coordination is also very, very important. And that's also what is worked on with the Foot Mentor as well, with Motus Foot rather.
So when you think about a time frame, I know it's individual, but yes, with her age, she's pretty strong and she's always been really healthy prior to this. She's 84 now and was always a walker and all this. So physically, she's in really good shape considering. But how long are we looking at? Because what our goal, immediate goal is to be able to get her out of bed and to be able to sit her in a chair and just be able to, bring her out of the bedroom and also possibly take her out to physical therapy at a facility just to get her out of the house, because we really are really still in the bed for the most part. Time frame wise, is there, with what you've seen thus far in this, what's the average amount of time just to get her out of the bed and functioning with with us, in the home and everything?
Sure. Yeah, I think you're exactly right. It's every individual stroke is different because every stroke affects every individual person differently, and everyone has their own sort of health-related factors that contribute as well as their age. So I always will start off with a very, very strong position, and that is defended by the science. And so if we look back to the scientific studies that were performed with the Motus Foot over the years, those studies generally lasted around 90 days or 100 days, so around 3 months. And following that period, we saw an average improvement in individuals' walking capacity in two primary things. One was that they were able to walk faster. And that's really interesting. And some may say, well, I don't care how fast I walk. I will argue that it's very, very important to be able to walk quickly. And it's not only that the walking speed is important, because it is, but the walking speed is also a surrogate for your ability to dynamically stabilize and be able to be safe walking. Very, very sort of relevant example or salient example is if you're trying to walk around in the community, there's a fixed amount of time. If you walk up to a crosswalk, there's a fixed amount of time that you have to be able to walk across that street to be able to get across it safely. And so walking speed is a very, very important metric. And that's one of the reasons why we measured it. And so we did see a relatively large improvement in walking speed. The other thing we also saw was a doubling or a near doubling of walking endurance in a given period of time. So those two metrics we saw, those improvements took around 3 months in the cases of individuals who were using the Motus Foot. And there were even cases where, not even cases, there were instances where people actually stepped up in what are called functional categories of gait. And that's what were called minimally clinically important differences. And these are big. These are big improvements that people can actually realize. And so while there's many sort of changes that that can be seen, it is a bit variable, and I think it's really dependent on sort of the level of motivation and the level of engagement. But generally, that 3-month period is when we kind of expect to see some substantial improvements in individuals' performance, just in the aggregate.
And the guidance we get will come from, I know, we initially will need some help, some assistance in setting it all up and all of that. So that would be.
That's what we're here for. That is what we're here for, guys. Yeah, in terms of not only me personally as a clinician, as a scientist, but there's also all the technical elements too, right? Once we're always behind every stroke survivor, every survivor of neurologic injury. But once you're kind of in the family, we circle around and we will do everything we can to help you be successful in this process. And whether that's from the initial onboarding process of, well, how do I turn this on? How do I plug this in? How do I put it on? All these sorts of things. All of these things we are here to help with. And also, as you progress, Rehab Power Hour is here to help actually go through and make modifications, make some adjustments. So very, very, we become a sort of a team surrounding your team for your mom.
Okay. Thank you so much.
Of course.